Section 16mm, sodium bicarbonate. Sodium bicarb is an alkaline, I can't ever say that word, so I'm not even going to try, alkalizing agent. It raises the pH of blood by buffering excess hydrogen ions that are present in an acidotic state or in acidotic states. The role of sodium bicarbonate is limited in cardiac arrest. Because ventilation is an effective tool in managing respiratory acidosis, sodium bicarbonate should rarely be administered for cardiac arrest, unless the arrest is suspected to be secondary to hyperkalemia or a tricyclic antidepressant over ingestion. So we used to do that all the time. For those of you that have been medics for a little bit, we give sodium bicarb on all these cardiac arrests. Well, we're not doing that anymore. So the only time we're going to give it is if it's known hyperkalemia. Known is a key word right there, or a tricyclic antidepressant. So the indications for this are going to be specific causes of cardiac arrest, like we just talked about, hyperkalemia, poisonings, tricyclic antidepressants, dialysis-related issues, also hyperkalemia, and then crush injury syndrome, hyperkalemia prophylaxis. Contraindications, known metabolic alkalosis. The onset is observed within 3 to 5 minutes after IV-IO administration. The side effects, sodium bicarb may inhibit oxygen release secondary to a shift in oxyhemoglobin saturation. It also may produce a paradoxical acidosis that can depress cerebral and cardiac function. Severe soft tissue damage can occur in extravasted administrations. The dosage of this, again, for pediatrics, you're just going to use your hand heavy. It's in a tube just like D50 is, and your dose is going to be 1 milliequivalent per kilogram IV-IO with a max of 50. It's supplied, again, in that pre-filled syringe. It's 50 milliequivalents and 50 milliliters, so it's going to be 1 per. And the special comment is something else to keep an eye on, and remember this, especially when you start doing your cardiac arrest codes or trauma codes or anything like that. You cannot administer with calcium chloride. So if you're going to give both of those medications, you have to have separate IVs. So again, do not administer with calcium chloride. It will form and obstruct the vascular access being utilized. So make sure you have separate lines on that.